Good afternoon, everyone. Welcome. My name is Diane Fabi King, and I am the representative of the National Health Service Corps. I'm a senior public health advisor, and we are very happy on here as well. We're looking forward to all of you being a part of this program. I will now turn this over to Sarah, who will get us started. Thank you, Sarah.
Thank you so much, Diane. My name is Sarah Gudeman. I'm a project coordinator and specialist at the Association of Clinicians for the Underserved. I'll be serving as today's moderator. Diane said we had a great start to our initiative last week. Today, we're going to explore how to measure your level of burnout and use this data to address the causes and symptoms of burnout. We recognize that burnout is an organizational phenomenon, stemming from issues that need to be addressed at the organizational level. However, the effects of burnout can vary from individual to individual, even those within the same workplace. We want to empower you to better understand your experience of burnout and to use that data to push for changes that will best improve your quality of life. We'll begin by reviewing a series of burnout self-assessment tools and the different dimensions that they use to measure burnout. We will then dive deeper into how to interpret these scores and use related tools to understand the causes of your burnout. Utilizing these tools will give you a framework to discuss your experience of burnout and language to advocate for yourself to leadership to push for changes. If you're interested in learning more, please join us for Series 2, where we'll look at how organizations can use burnout assessment tools to measure clinician burnout and address it across their clinical staff. Before we dive into today's presentation, there are a few housekeeping items I'd like to take care of. This webinar is being recorded. The recording and webinar slides will be emailed to you within 2 days of the presentation. Related documents are available in your webinar information page, linked in your invite, as well as in your NHSC portal for either participants or points of contact. The first hour will include a presentation on burnout self-assessment tools, and that will be followed by Q&A at the end. Please feel free to type your questions in the chat as we go through this presentation. We will not be calling on you if you raise your hands. So if you need to access the chat, please click the icon in the bottom right-hand corner of your screen. If you need direct technical assistance, please reach out to our colleague Josh. His information is pasted in the chat as well. The second hour of this webinar will be a time for networking and peer engagement. Please stay on so that you can connect directly with your colleagues. For those of you looking for closed captioning, please click on the CC icon in the bottom left-hand corner of your screen. I'm excited to introduce today's speaker, Molly Mindbress. Molly Mindbress is the Director of NHSC Educational Programs at the Association of Clinicians for the Underserved. She has provided training and technical assistance to clinicians in the health center field for 9 years, directing research and clinical education at the National Health Care for the Homeless Council for 8 of those years. Molly has provided direct services to individuals experiencing homelessness and other low-income and underinsured populations for 7 years. She has extensive knowledge of social determinants of health that historically marginalized populations face and expertise in building community partnerships to connect those individuals to social services. I'll hand the mic over to Molly to begin today's presentation.
Thank you, Sarah. Thank you, Diane, for those lovely introductions. I'm really happy to be part of this initiative. If you were on the webinar last week, you might have seen me moderating. Sarah and I will take turns throughout the year moderating session. So, and welcome to the new folks who are just joining us today. So I do want to tell you really quick, this is going to be a very fast whirlwind of a presentation. There are 7 burnout assessment tools I'm going to show you today. So we'll have to work through them pretty quickly so that we have time at the end to practice using one of them. So on that note, if you could get out a piece of paper and a pen, or get your phone out to take notes on scores that we'll be looking at an assessment tool later to track, and then also a calculator or your phone to calculate your score. So just wanted to warn you about that for later on. But thank you so much for being here today. Here are our learning objectives. We're going to define burnout. We'll describe how to use burnout assessment tools. We'll list commonly used and validated burnout assessment tools. And then finally, we'll discuss how to approach leadership about workplace modifications to prevent burnout. So of course, we'll start out with the definition of burnout. And we're using the World Health Organization definition, which is a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. And there are 3 dimensions of this definition, which on the right side of the screen, you'll see the first one being exhaustion. So that's like the physical, emotional, psychological exhaustion that you might experience as part of burnout. And then the second dimension being mental distancing or negative feelings towards work, that detachment you might feel from your patients or your coworkers when you're burnt out. And then reduced personal effectiveness on the job. Maybe you're just feeling like you're coming to work, you're there, but you're just not doing things the way that you would if you were feeling your best self. And so what are reasons that people might experience burnout? Well, first of all, we've got lack of control. If you don't have much control over your schedule, like how many patients you see per day, or how much time you have with those patients. We know that folks that we're seeing in health centers and other health professional shortage areas have lots of barriers to care, those social determinants of health Diane was discussing. And sometimes they're coming in with a list of issues they need to address, and we're not going to be able to address all of them in one visit. So if we don't have a lot of time, we might feel like we're just not doing what we really wish we could do. We may not have control over decision making in the organization, in your department, in your clinic, and that can be really frustrating and lead to burnout. Maybe you have a really high workload. Again, you're seeing patients with really complex needs, multi-morbidities, psychiatric issues, mental health issues, substance abuse issues, and you really need to spend a lot of time with them. And then also the documentation issues. Are you spending hours like late into the night doing them? Are you going home and taking your notes at home? Is it interfering with your home life, with your family time? And then lack of supportive leadership can really lead to burnout issues if your leadership is not encouraging you and providing the proper training. Maybe they're not rewarding you or letting you know when you've done a really good job. That can be difficult for folks. And then again, those work-life balancing issues. Are you taking work home? Is it interfering with your personal life? Or the exhaustion is just like making you so tired that it's really hard to focus on your family or your social life when you get off work. And then that last bullet, moral distress, and I don't know if folks have heard this term, but it's being talked about more, but it's that inability to provide the needed services to your patients because of reasons outside of your control. Maybe there's policy issues or funding issues, or you're not able to make the right kinds of referrals, and you feel this distress over that, and that can happen a lot in under-resourced service settings. And then moving on to the next slide, I'll show you that moral distress over time, layered with the burnout, like all of that can lead to what we're calling moral injury. So that's like the emotional and physical outcomes of long-term moral distress on the clinician. And I think this really was illustrated during the COVID-19 pandemic, when there were so many questions and issues around people being vaccinated, or people not getting the chance to be vaccinated, or you're not able to see clients because maybe you're only operating remotely, or people aren't able to get surgeries because the hospitals are full. So there was a lot of moral distress around this, and then that long-term distress really becomes this injury that very harmful to folks in the field who really want to do the best they can and provide the highest quality care, but things outside of their control are not letting them. And here are some examples of how burnout impacts clinicians. There's the physical and mental health issues. So you might get headaches, you might get backaches, you might also feel depressed, anxiety, and then that extreme fatigue that you might feel at the end of the day. And that really builds up over time if you're not getting enough sleep over and over again. That can cause a lot of issues. And then there's memory and concentration issues. Are you having trouble at work even remembering what clients told you, or just concentrating on your documentation, or in meetings? And then medical errors. There is research that shows that clinicians who are experiencing burnout may have more medical errors than those who are not. And so it's impacting your patients directly. And then the patients feel that if you're tired and you're not able to concentrate, they can tell, they notice those things. And so their patient satisfaction can go down. And then some folks who are experiencing high levels of burnout and it's not being resolved over time, they may have a desire to leave healthcare altogether. And we really don't want to see that happen. And that's a huge part of why we're doing this whole initiative, is to make sure that you all are able to identify burnout in yourselves and your leadership as well, and that organizations are taking steps to make sure that we're reducing the experience of burnout. And if people are experiencing burnout, then we know how to address it. We know what coping strategies to implement and changes to make in the workplace environment. So talking about those steps against burnout, what can we do? What can we start with? Well, using burnout assessment tools should be one of the first steps you take to really help evaluate your personal level of burnout as a clinician. I know we probably have some administrators, leadership staff here today. So that's also assessing the burnout level amongst your clinicians and maybe other staff too at your agencies. And understanding burnout levels can help us see, is it a problem overall? Is there a problem in a certain department? And then for individuals, like, where is this burnout coming from, or how is it manifesting, so I can pinpoint my coping strategies to address those particular areas. And when you're picking a burnout assessment tool, you really do want to make sure that it's validated and it's reliable. And these are kind of like scientific research terms. But basically, reliability means that tool is consistently resulting in the same scores over multiple tests, and that validation is that it's actually measuring what it's supposed to measure. So, you know, when the PHQ-9 for depression was being developed, I'm sure a lot of you know about it and use that. It was researched with probably thousands and thousands of patients and clinicians to make sure it's measuring what it's supposed to measure, depression, and that the people using it are getting accurate scores each time. And then also around burnout assessment tools specifically, what dimensions of burnout are they measuring? And are they the dimensions you want to learn most about? And then finally, is there a fee to use it? So when I go over these, I'll let you know about these different dimensions and the fees, but all of them today have been validated. So that's one thing that you can feel good about. And do know that we, on the right over here on the screen, you can see we have some great infographics for this series, one of them being the signs of clinician burnout, so that you can help familiarize yourself with signs and symptoms of burnout. We also have an infographic showing all of the burnout assessment tools I'm going to go over today, as well as an executive summary on the same topic. So I will be sharing my screen with you all, and I will do like a verbal check with Sarah, our moderator, to make sure that y'all can see my screen when I do share it. But we're going to start out with the Maslach Burnout Inventory, or MBI. It's the very first burnout inventory that was developed decades ago, and it's the most researched and probably the most used. And it can be used for lots of different occupations, but they have one specifically for medical personnel, and it's measuring the dimensions or subscales. I'll probably use those terms interchangeably. Emotional exhaustion, depersonalization, and personal accomplishment. So it's really matching up with that burnout definition that I gave you at the beginning. So I'll go ahead and share my screen and let you all see what that looks like. This is one that does cost money. It's about $15 for an individual report. Sarah, can you let me know if you can see my screen?
Yes.
Okay, great. Thank you. So this is the Mind Garden website. You can see the authors are Christina Maslach and Susan Jackson. You'll see Christina Maslach's name all over the literature around burnout and the Maslach Burnout Inventory as she developed it. But if you go down, scroll down, you can see that there's different ways that you can access the inventory. You can request an individual report. But again, you do have to pay $15. And if you click on this tab, you can also see sample items from that assessment tool. I'll show you really quick. There is a John Snow document. It's a HRSA document that John Snow developed. It's the HRSA Health Center Workforce Survey Literature Review Summary. And that is linked in our infographic on these assessment tools. That's really the only place you can find a copy of the tool without actually purchasing it. So it's in this HRSA document, which is really helpful. And you'll see all the questions here, and they're grouped into emotional exhaustion, depersonalization, personal accomplishment. I want to stop sharing my screen for a minute so I can show you how it's scored. So there are statements that you basically respond, I'm feeling this way, never to daily, and it's 0 through 6. And then what you would do is calculate, you'd add up the scores within each dimension of burnout or subscale of burnout. And then if your score is greater than or equal to 27 in the emotional exhaustion, you've got a high level of burnout. And you can see the other scoring below that. And sample survey items were like the emotional exhaustion one. I feel emotionally drained from my work. Or in the personal accomplished dimension, I have accomplished many worthwhile things in this job. So I think I will move on because there's so many more to do. But, I did want to show you one more thing, actually, that when you do the MBI online and pay for it, they will give you a report. This is a sample of that report. So it will show you, it'll tell you a little bit about burnout, and then it'll tell you your profile and what your scores mean. So it's a really helpful report if you choose to pay for it. All right, I'm going to move on. And you will, when it shows you the scores, they'll kind of give you these 5 work experience profiles from burnout to engagement. And you can see that the type of profile that it shows depends on your scores in the different dimensions: overextended, ineffective, disengaged. And if you think of burnout as like a spectrum, there's burnout on one end and there's engagement on the other. The next tool I want to share with you is the Oldenburg Burnout Inventory. This can be used by anyone in any occupation. Now, it's measuring exhaustion and disengagement. So it's not measuring that last one around personal efficacy or personal accomplishment. And the reason for this is that the developers really felt that personal effectiveness was a result of the exhaustion and disengagement. They didn't really feel like it was part of the burnout definition. So they really dig deep into exhaustion, the emotional, physical, and the cognitive fatigue. I'll share my screen again to show you how to access that. Again, the links are in the infographics, they'll be in the PowerPoint slides, and the executive summary. This one's a little awkward because you go to a page with an article, and then you have to scroll to the end, and hopefully you all can share my screen. Sarah, feel free to let me know that you can see
All
it.
good, Molly.
Thank you. Okay, you scroll to the very end, and in the appendix, it shows the Oldenburg burnout inventory. And I'll take a minute here to just explain the reason why some of these are not available so easily is because a lot of them were developed for research, not necessarily for individuals to do a quick assessment and see what their burnout is. And that's also why some of the scoring is a little bit difficult. So the one we're going to practice later is more straightforward, but like in this one, it's again, there's statements that are listed, and then you mark how strongly you agree or disagree with the statement. And I'll note about this one and some other ones, some of them are positively worded and some of them are negatively worded. And so you can't just add up your score and get a score. You have to do what's called reverse scoring, which to me makes it a little bit difficult to do. And at the bottom here, you can see which ones are reverse scored. If I go back to the slides, I'll show you, once you do calculate your average score per dimension, you can see that you'll have a high level burnout if your score is greater than or equal to 2.25 in the exhaustion scale, and if your score is greater than or equal to in 2.21 in the engagement scale. And so another issue like with this assessment tool and the MBI is that there's multiple scales measuring the totality of burnout. So again, you're not getting a total score. You're having to look at burnout in pieces, which some people would say is a criticism of these kinds of tools. The third tool I'll show you is the Copenhagen Burnout Inventory. It's for anyone in a human service occupation. And so they've done something different too with the measures. They're only looking at where the burnout is coming from. So they're just looking at this fatigue and exhaustion. They see that depersonalization dimension as more of a coping mechanism to burnout. So they don't think it's part of that definition. And they also feel that personal accomplishment, that dimension, is a consequence of burnout. So they're not including them at all in their definitions. But they want to know where is your burnout coming from? Is it coming from your personal life? Is it work related? And is it client related? So that's why anybody could technically do this tool. They could, if they don't have clients, they can not do the client related dimension. Let me show you now how that one looks. When you get to the Copenhagen Burnout Inventory link, you'll have to click on Copenhagen Burnout Inventory, which I've already done, and it'll show up in a new window. And there are the three dimensions, right? So we've got personal burnout. So how often do you feel tired? How often are you physically exhausted? So it's just about you. And then the scoring responses are always, often, sometimes, seldom, never, almost never. And then the second dimension is the work-related piece. So is your work emotionally exhausting? Do you feel burnt out because of your work? Does your work frustrate you? And then the client-related burnout questions. Do you find it hard to work with clients? Do you find it frustrating to work with clients? Does it drain your energy to work with clients? So this is going to help you figure out, is it the clients that are related to your burnout? And if not, is it work related? So that also helps you to figure out like where to address issues when you're trying to resolve your burnout and decrease your levels of burnout. So like, okay, it's not the clients, but it's definitely work related. Let me focus there. So that might be like structural issues in the workplace, like your EHR documentation, things like that. This also includes reverse scoring, which again kind of complicates it for folks who are trying to do like a quick assessment and score. And I hope this is going okay back and forth between sharing my screen and the slides. So you'll see that you're going to complete averages per dimension. And if your score is greater than or equal to 50, that means that burnout is present. This one is also free, which is a plus. So this next one is the Mini-Z survey. It was originally developed for physicians through the Physician Work-Life Survey, but actually they've now created lots of different versions for all kinds of folks in lots of different occupations. But they have one specifically for clinicians, that's the Mini-Z 2.0, and also one for residents and fellows. And then there's even one for leadership and administrative staff. So I'll show you on the website where you can access that. But this is measuring the supportive work environment and the work pace and EMR stress. So the overall score is going to tell you if you have a joyful workplace. But if you just want to look at burnout, there's just one question that I'll show you when I share my screen that's really getting at burnout. So you can do the whole assessment, or you can literally just answer one question on burnout. So once you get to the Mini-Z survey website, it's the Professional Work Life website. You'll scroll down, it's also free. Mini-Z is where you'll click for the one for clinicians. The Mini-Res is that one for medical residents and fellows. The Mini-Z administrators and leaders. So folks here who are site staff, you could use that one too if you want to check out your burnout level. They also have a Mini-Z general for anybody. So I'm going to go ahead. If you click there, it'll open up. You'll have to download a copy. So I've already got that downloaded here. And you can see what it looks like. It's just 10 questions. The ones that are in yellow, those are the ones that are part of the supportive work environment dimension. The ones in green are part of the work pace and EMR stress dimension. I really like this one because it kind of gets at the causes of your burnout. Not all of them do that. So this one is great for that purpose. And you can see this question number 2. This is the question that's the, oops, I tried to highlight it, but that didn't work. It's the question it's called a one-item measure of burnout. So they're literally just asking you, using your own definition of burnout, please choose one of the numbers below. And basically, if you choose 1 through 3, I feel completely burned out. Symptoms of burnout that I'm experiencing won't go away. I'm beginning to burn out. That means you probably got burnout. So it's a pretty direct and easy one to use. Here's that one-item burnout measure. Oh, I did want to add too for the Mini-Z, if you get a score of 20 or higher on the work pace and EMR stress one, it means you have a reasonable work pace and stress level. And then if you have a subscale score of 20 or higher in the work environment one, then you have a supportive work environment. Okay, so let me move to the next one. We have 3 left. We're getting there. So the Stanford Professional Fulfillment Index. This one is really for physicians and biomedical research scientists. So of course, it may not be very useful to the nurse practitioners we have on the call, or dentists or PAs. So just keep that in mind. But it is used frequently, and it measures professional fulfillment and burnout. So you can just focus on the burnout subscale of this tool. And what they're looking at in terms of burnout is work exhaustion and interpersonal engagement. So they also took out that personal effectiveness one, like some of the others did. And I'll show you where to find that one. Oh, sorry. So this one, you would do it online and it goes straight to the burnout subscale. If you scroll up, you'll also see the professional fulfillment scale. I'm just going to show you the burnout related questions. So this one's different in that it's during the past 2 weeks I have felt. The ones I've shown you so far don't have a time range for, thinking about your burnout experience. And so that's one that you can use to show, look at differences in burnout levels before and after an event, like before and after a COVID-19 pandemic, perhaps, or before and after a new CEO, or an intervention that you're trying to use to help with burnout. So once you fill out all of this information, then you click on this arrow and it'll give you a score. I will add to, there are other scales here that you can use around self-compassion and sleep-related impairment. I think I need to move on, so I'm going to move forward. When they give you the report, it'll say favorable or unfavorable burnout level, and it'll kind of help you interpret your score there. The sixth one is the professional quality of life measure. People also call it ProQual. This is for anyone working with individuals who've experienced extremely stressful events. It was originally designed to look at work satisfaction and negative effects of work-related trauma, working with people who were victims of torture. So that's a really interesting background of this tool. But it's now been expanded to anyone, again, like I've said, who works with folks who experience extremely stressful events. And that's probably everybody that you're working with, wherever you are in a health professional shortage area. So there's two scales we're looking at here, subscales: compassion fatigue and compassion satisfaction. Compassion satisfaction is the pleasure you derive from being able to do your work well. And that compassion fatigue is made out of burnout and then the secondary traumatic stress. So things that the secondary exposure to traumatic events from your workplace. I'll share my screen and show you what that looks like. Sorry, I have to move these things to find where I need to go. So once you get to the ProQual website, you can do it online if you want, but you can also just keep scrolling and go down to the English version and download it. And I'll show you here too, if you click on self-score, it will show you how to score it. And they have translations in other languages, which is really cool. So I've already downloaded the English version, and this is what it looks like. Again, you'll get really used to these Likert scale response options. You've got statements, and then you respond that this feeling happens never, rarely, sometimes, often, very often. Again, this one also gives you a time frame for looking at that burnout. It's in the last 30 days. So another one that you can use to compare levels between interventions or really important events. It also has reverse scoring, like some of the other ones that we looked at so far. So again, that kind of complicates the scoring. Here's what the scoring document looks like from that same website. If you scroll down, here's where you'd enter your scores. But this is where you actually figure out what your score is, and it'll tell you what those cutoff scores mean, that you have low, moderate, high compassion, satisfaction, your burnout is low, moderate, high, and your secondary traumatic stress level. So this one's really great. They give you lots of information about scoring, and this one is also free. All right, I'm going to keep us moving. Finally, we've got the burnout assessment tool. So this can be used by anyone in any occupation and even those not working. There's 23 questions. And the measures are on exhaustion, mental distancing, emotional impairment, and cognitive impairment. So for this one, they're not looking at personal accomplishment either, but they are looking at that disengagement piece, the mental distancing piece. Those are the core symptoms they look at. You can also use this tool to look at secondary symptoms, so the psychological distress that comes with burnout, the psychosomatic complaints, and depressed mood that can also result from burnout. Oh, sorry. Let me share my screen to show you what that one looks like. Once you get to the Burnout Assessment Tool, or BAT, as it's conveniently called, you'll scroll down to the part that says questionnaire. And again, they have lots of different translations. I'm going to pick the English one because that is the language I know best. And I think I pulled it up here. Yep, here we go. So there are two versions of the BAT. There's the work-related one, and I think it's called the general version. Yeah, so you'd want to use the work-related one if you are working and want to see if your burnout's part of your work environment. So again, we've got these Likert scales. These are all worded the same way. So there is no reverse scoring, which makes this one a lot easier to score. And it looks at cognitive functioning and memory, which a lot of the other ones do not. So that's really helpful too, to pinpoint how your burnout is manifesting. Okay, I think I will stop sharing. I think we're doing okay on time. This is the part where I want to show you how to score it. So they have a traffic light scoring system. Basically, you're going to calculate the average of your score from all 23 questions. So there are different subscales you can analyze separately, but you can also do it for one total score, which makes it unique compared to the other tools. And once you've got your average score, the response options are 1 to 5. So once you've got your average, if your score is less than or equal to 2.58, no burnout, 2.59 to 3.01, risk of burnout. So you might be getting there, but not quite there yet. It's a good time to intervene. And then if your score is greater than or equal to 3.02, burnout is likely. All right, so this is where I want you to get out that pencil, pen, and paper, your phone, wherever you can track your scores, and a calculator or your phone. And Sarah is going to put the URL of the Burnout Assessment Tool in the chat. And we're going to have you all open that up and actually complete it yourself. Record your answers for each question, add up the scores. Just do the questions 1 through 23. You don't need to do the secondary symptoms. And that will give you your average burnout score. So we'll give you, I think it takes about 3.5 minutes to do the 23 questions. So set a timer and let you all work on that. I can also pull back up the version of it here in case you want to just look at it on the screen. So I'll give you a couple minutes with the first section, and then I can move to the next one. But remember, never is a 1, rarely is 2, sometimes is 3, often is 4, and always is 5. So we'll get started on that. I will share my screen, and then Sarah, if you can let me know if anyone has questions in the chat that I can help answer, that would be really helpful.
Sure thing, Molly. Molly, we have a question on calculating the score.
Okay, so what is the question?
Can you explain how to calculate this score?
Oh, okay. So for example, for question 1, at work, I feel mentally exhausted. If you say sometimes, that's a 3. And so on and so forth for all the other questions. So you want to keep track of, did you answer 1, 2, 3, 4, or 5 for each question? So then you'd add up all of those. There should be 23 total, and then you divide that total by 23 to get your average score. Does that make sense? Did I explain that okay?
I think so. Erin, if you have more questions, please feel free to enter in the chat. Oh, yep, there's a yes, thank you.
Okay, perfect. I'll move to the next couple subskills for anybody who doesn't want to open it on their own computer or can't for whatever reason. I think it's been a couple minutes, so maybe we'll take one more minute. But let me know if you all need more time, if you're still figuring it out. And maybe I'll stop sharing my screen and go back to the room so I can see what's going on in the chat.
Holly, this is Diane. We have someone who's indicating that they are not letting me access the website. It says it is unsecured. So perhaps you might be able to go back again and view that from the screen for that participant.
Yes, I can do that. Yeah, that might be sound like that might be a firewall issue potentially on your end. So yeah, I'll share my
Yes.
screen again.
Thank you, Molly.
Yep, thanks, Diane. Okay, let me go back to the first page. This is also a PDF, so we could probably download it and share it some other way if you would like. Maybe not right at this moment, but down the road. I'll go to that second page and then we'll finish up in about a minute. All right, I'm going to stop sharing my screen mostly because I don't want to take up too much time, so I can finish my presentation and we can have some Q&A. All right, so hopefully most folks were able to get their average for the first 23 questions. And again, here's the traffic light scoring. So if you're in the red and burnout is likely, you'd have a score of greater than or equal to 3.02. If you had a score between 2.59 and 3.01, you're at risk of burnout. And if you got a green, a score of less than or equal to 2.58, no burnout. So well, and we can talk more about these scores in the breakout sessions. Don't feel like you have to post your scores in the chat and admit to everybody what's going on, or do, because also we probably should not stigmatize burnout. We're probably a lot of us are feeling it and we should be talking about. So if it makes you feel good and free, go ahead to put your burnout score in the chat. Let everybody know. But what we're going to talk about now is what to do with these scores. So just getting the score isn't going to solve everything, but it can help you do a few things. It can help you see what dimensions of burnout are impacting you most. And depending on the scale you use, that'll depend on your results. So you can look at your level of exhaustion, your level of disengagement from the work, your level of feeling ineffective. But it can also show you, like, is it client related? Is it more personal, or is it from EHR? Is it from supportive environment? And then you can also use the associated manuals and scientific articles related to those scales. That's going to take a lot more work, but again, are you looking at the multiple subscales or the single total score? So like for the burnout assessment tool we just did, you can look at the total score, but you can also look at your averages within the subscales. So maybe you just want to focus on your exhaustion or the mental distancing or the emotional impairment, the cognitive impairment. And then some tools actually have like national benchmarks, or they can show you how other people are scoring on those specific burnout scales, like nationally or like in your region. Or if you're an administrator and you're looking at this in your organization, you can look at burnout levels within a department, within a specific team, or at a certain site. And then individuals can compare their score to everyone else at their site or everyone else on their team. That can be really helpful too, to see how you're doing compared to other folks. Not to say like one person is more resilient than another or has like more issues, but like can really show you like what am I dealing with like in my work environment that's really different from these other folks, and how we can like make sure everybody's experiencing less burnout. And then something else to think about is like some of these burnout assessment tools have companion tools to really help you think more about the causes of that burnout in your workplace. So one that I like that's really nice is called the Areas of Work-Life Survey. It's also from the developers of the MBI. So of course you will have to pay for it. But what's really interesting about that one, I don't think I have time to share my screen, so I probably won't, but it's on the same website that I showed you before, is that you're looking at 6 areas of work life where you have mismatches between yourself and that work environment. So the first one is workload. So like your work demands exceed your limits, you're overloaded, you've like gotten to the point where you can't recover. Or the second area is control. So like we talked about before, do you have opportunities to be part of decision making and solve problems that are related to like your work? And so if you have mismatches there, it can really help you pinpoint where to address the burnout. Reward is the third area of work life where someone could have a mismatch. Are there mismatches around being recognized, or financial support, social support. Does your boss tell you when you do a good job? Are you getting paid enough to really take care of yourself, to pay the rent, to pay the bills? And then that fourth area of mismatch is around community. So that's the social context in which you work, and it includes your relationships with managers, your colleagues, your patients. What is interpersonal content like in your organization? Do people work well on teams? How are those relationships? The fifth area of work life where there could be mismatches around fairness. So what does it look like in terms of like equity and social justice issues at your work, and fair work decision making, and respect between coworkers, and equity between coworkers? And then the sixth one is around the values in the workplace where there can be a mismatch, like around job goals and expectations. Do you have the same values as the organization where you work, as the people in leadership? So when those things are matched, then people are going to have less experiences of burnout. They're going to feel supported. They're going to feel like they're in an enjoyable workplace, and they're able to have access to the things they need, and they feel supported. Another one is the generic deep dive for clinicians. I think I'm running out of time, so I won't share that either, but it's just it's from the folks who developed the mini Z. It again really gets into the issues in the workplace that are related to your burnout. We didn't have time to go through that today, but that one's like pretty extensive, but could be extremely helpful to you. And I wanted to show you real quick the infographic that we developed that lists all the burnout tools that we just went over. I think it's the only one of its kind in the world. If I'm wrong, let me know. But basically, we have all those 7 burnout assessment tools listed, links to them, who the audience is, the dimensions that they measure, and then how to score them, and links to more information about scoring. I think it's a really useful tool. The second page shows you just some tips around interpreting your score, investigating the causes of your burnout, and strategies to address those causes. We also have an executive summary that goes over the tools as well. I do need to move us along. Addressing burnout, like I mentioned before, communicating with your leadership. So we all, I'm sure, have team meetings, whether they're weekly, bi-weekly. Some people have huddles every morning. Are we talking about burnout at those meetings? Can you talk to your medical directors and clinic managers? I think the more often you talk about it, and you have other people on your team talking about it, it will show leadership that lots of people are concerned about this and want to work on it. It's probably why you're here today. And then also recommending regular evaluation of burnout. Are we looking at burnout scores with our clinicians on a regular basis? Are we looking at how they change before and after certain events? And then really looking at those causes, including moral injury, like we discussed. And then, like, once you know the level of burnout in your organization or in yourself, this is when you can advocate for modifications, and you have like this data, this evidence to show folks at your organization about that. And I wanted to mention too that there is I think it's on the Mini Z website where they have that survey. They have a tool. It's like a template for reporting burnout results to your leadership. So that's really useful too. And types of organizational interventions, you could have scribes to help with EHR documentation. In the research, this is showing really positive results, having scribes and reduced levels of burnout. Ensuring adequate time with patients, as we discussed, folks who need a lot of attention, and they've got a lot of barriers to care and issues that they're dealing with, and they need a lot more time in those clinic visits, more than 15-20 minutes. Limiting the hours worked per shift, so clinicians aren't overworked. Allowing for flexible work schedules. I think I've heard from a few NHSC participants that this may not be something that can be changed at the moment, but maybe it's something that is advocated for on a larger level, like changing the requirements for an NHSC participant. So there is more flexibility to maybe work part-time or shorter hours, fostering that shared decision-making, like including administrators, so like including clinicians in decision-making around policies that impact them and their patients. And then financially supporting professional development can really help folks get away from the clinic for a while, get that breathing room, and learn about new skills and information that they can apply when they come back. And then personal practices, managing these burnout symptoms that you're experiencing, you know, until you can change the bigger organizational stuff, is maybe you need to seek medical or behavioral health advice or treatment if you are feeling those physical and psychological effects of burnout. Social support, extremely important. It could be from coworkers, it could be friends, family. Positive reappraisal, so like reframing situations, thinking about the good things that can come out of scenarios, not just ignoring what's happening and saying things are fine, but just trying to look at things from a different angle. Mindfulness, being in the present, helping you ground yourself, and meditation and physical exercise, getting those endorphins going. Our next webinar on March 1st is all about coping strategies. So I know I just like rushed through those, but that webinar is going to be provided by a behavioral health provider, and we'll have a coaching session afterward who knows a lot about coping strategies as well, and we'll get to talk to you all about those. So please come back for that one. I think that's all we've got time for today. I know I hit right at the hour, so hopefully we've got some time for Q&A, and I'll hand the mic back to you, Sarah. Thanks, everyone.
Thank you so much, Molly. Since we're right at the hour, I didn't see any questions in the chat. I just wanted to make it an open opportunity for people to ask questions to Molly directly. So if you'd like to ask a question, click the raise hand icon at the lower bar of your webinar screen. You can find it towards the center right. If you raise your hand, you'll be allowed to unmute and ask Molly your question directly. I think I see one question here. Right, you should see a request coming through.
Hi, Molly. Can everyone hear me okay? Can everyone hear me okay?
Bit
Yes.
of an echo, but we can hear you.
Okay, great. Thank you for this great presentation. My name is Stephanie Patterson. I'm a practicing psychiatric nurse practitioner, so I work in mental health. I think these assessment tools are very important, especially as it relates to screening for burnout among providers who have been working through the pandemic. I guess this is more or less a two-part question. I think the tools are great. However, I kind of noticed some parts that may need appropriate follow-up with a physician. I was looking at fatigue, and there are a number of different condition or underlying conditions that an individual may have that could be undiagnosed, that could lead to increased fatigue that is not necessarily related to burnout. I'm thinking about possible hypothyroidism, or even undiagnosed ADHD, which might impact a person's ability to stay focused. So I wanted to get your thoughts on that. And the second part is that I think also this is an opportunity for HSC as well as HRSA to consider, now that we have a lot of information that kind of links the pandemic to an increased risk for burnout, to consider reducing that 40-hour requirement to 32 hours to allow for appropriate work-life balance, considering that so many clinicians have been exposed to an increased risk or rate of witnessing people die or death. So that piece is also important if we want to talk about burnout and appropriately managing the symptoms that go with burnout. So that was pretty much more or less my question, and it's a two-part.
Thank you, Stephanie. I think you brought up two really good points. I'll try to address the first one first. Yeah, I think you're right. There probably are medical conditions that could potentially be causing some of these symptoms that also can manifest from burnout. And so maybe using a tool that's looking at multiple dimensions of burnout, not just the exhaustion. So looking at the detachment piece, and maybe that personal effectiveness piece or efficacy piece could really be helpful in separating out, is it from something else, or like the one that's you can look at personal burnout, work-related burnout, and client-related burnout. Like that one may help as well. So maybe you're showing, oh, I'm not burnout from clients, I'm not burnout from work, but something else is going on. It's not related to work. And also, I think using those tools that are like companions to these assessment tools to look at the things actually happening in your workplace that would really be related to burnout. So that could maybe help you separate out what it is. But yeah, I do think if you're scoring high and you're feeling some of those physical or psychological impacts or cognitive impacts, it can be really helpful to go to medical provider. And if you're having them anyway, and you don't even suspect burnout, yeah, I think any time would be great to go see a provider to figure out if it could be something else. And then the second part, yeah, unfortunately, I don't have any control or say over these requirements for the National Health Service Corps, but you're not the only one who's brought that up. And it's the reason I mentioned it in the webinar is because a couple people have written to us, when we're promoting these webinars, is talking about that more than 40-hour a week requirement. And that is something that's recommended in the literature, is to allow for flexible hours and part-time and shortened work days. So I think it's definitely something to advocate for locally if you can. If it's more of a National Health Service Corps requirement, I think that's a much bigger conversation and sort of advocacy piece that could be addressed. And Diane, I don't want to put you on the spot. There you go.
No.
Okay,
I have myself unmuted. I wanted to say thank you to the clinician who brought that up, and that's why I'm here. We wanted to develop this program for our clinicians so they have a forum in which they can learn and ask questions. And so from my perspective, it is something that we hear from you. And I am the one who's going to be making notes and taking it back and seeing what we can do with our policy office, with our constituents, etc. We also have our site administrators. So there are multiple entities in NHSC that reach out to site administrators who are with the clinicians and looking to find some different ways to support. And this is one of them. And so your voice is heard. I'm happy that you spoke up about that here today. So thank you. I think your name was Stephanie. Not sure, but thank you so much.
Thank you, Molly and Diane. We have time for one last question before we head out to our breakout rooms. I think I see one person now. See a request to unmute. Please go ahead and ask your question.
All right, thank you so much. Thank you so much. One of the things that's up from the perspective of NHSC is, I'm currently a student, so I'm not a practicing clinician yet, but I could imagine that flexibility in this domain of work hour requirements might make the applicant pool broader as well. I would imagine that increasing flexibility around work requirements for NHSC could attract more potential candidates, kind of establishing National Health Service Corps as a leader in the field for this sort of flexibility that mitigates burnout in a setting and work landscape where it's already so prevalent in a lot of health systems. I think this is a real opportunity to establish HRSA as one of the leaders in the field in this domain. So I just wanted to express that. Not really a question.
I think that's a great point, Bradley, because oops, echo. Oh, thanks, Sarah. I think it's a good point because as far as I understand, there is a lot of funding in the National Health Service Corps pool. And so I think, as you said, changing those requirements would allow more people to participate who are limited and can't work full-time for whatever reason it is. So Diane, I don't know if you have a response, but I agree. I think it definitely could open it up for more people to participate.
My response is the same, that this is why I'm here. This is what we're looking for. We want to know these things directly. I have echo as well. So thank you for that. Thank you for that. I have notes that will be going back to my office.
Thank you so much for everyone for chiming in. That is all the time we have today for Q&A, but I hope you all stick around for our affinity groups where we can continue to have these discussions. Thank you so much to Molly for your presentation. I just want to flag that if you're interested in gaining a better understanding of any of the topics covered today, you can see the references that are included at the end of this presentation. As a reminder, these slides will be emailed to you within the next 2 days.